In my youth, I noticed that my gum lines were receding, and I didn't have consistent dental care. And Dr. Vance explained that this disease is progressive, that you don't really, it's not really cured, but it's something that needs to be attended to by a professional. He explained early on in this treatment process that his objective was to maintain the teeth that I had, to help preserve them, which he has done over the years. I've lost some due to cavities, and some of the teeth have become loose and had to go. But he's still following through on his objective of maintaining as many teeth, natural teeth as possible. Well, as I recall, prior to laser surgery, the depths were 6 to 8, and there were some that were less, but after laser surgery, in general, they've decreased to 3 or 4. I believe that Dr. Vance and the goal of his staff are to maintain my natural teeth for as long as I live.